Hello, this is Dr. Gay from First Look MRI. This is a really quick case on an 18-year-old who twisted the ankle. And this is an axial view, and we're slicing into the foot here. This is the midfoot. Here's the calcaneus in the back. As we go up, I have some arrows pointing out some pathology. And they have a marker up high here over the anterior lateral aspect. So this is right in the area where we usually get ankle sprains, and indeed this is just a classic case of an ankle sprain. The ligament that is usually injured is right here. This is called the anterior talofibular ligament. This is the talus. This is the fibula, so they call it the anterior talofibular ligament. There's also a posterior talofibular ligament back here. And this is the one that's usually ruptured or torn. In this case, it's not completely torn, it's just really thick. Normally we see a thinner, sharply defined dark band, and now it's just way too thick and gray. So a high-grade sprain, partial tear of this should go on to heal just fine. It'll shrink back down and scar up, so not a big deal. But this is what they look like when they're just a prominent sprain but not ruptured. And the patient did have one more thing. Over here we have two tendons in the lateral side. These are the Peroneus, Longus, and Brevis tendons right next to each other. As we go down here, we see the Brevis turning a little gray, Longus looking great. And on this view, I put some arrows right there. It has really gray. So this is a partial tear and attenuation of the Peroneus brevis as it wraps around. And this goes along with that pain on the lateral side. They also have some gray signal underneath it. I'll move this arrow right there and right here. The calcaneofibular ligament is another ligament that comes off the back of the calcaneus here, and it wraps underneath these, and it comes up to the fibula, which is right here. Really hard to see, but it wraps underneath here, and that is also too thick, so a sprain of that. So they have two lateral ligaments that are sprained. The anterior talofibular, very thickened and gray. The calcaneofibular ligament, very thickened and gray. And then this partial tear or tendinopathy of the Peroneus brevis tendon, and its next door neighbor here, the Peroneus longus. Looks good. Thank you very much.